good afternoon for the rest of us. Remains a good morning. It's a pleasure to be on the call with all of you today. Looks like there's almost 30 of us, and I know there'll be some more folks joining. My name is Travis Parker, and I'm a program area director with Policy Research Associates based out of Del Mar, New York. I'm responsible for overseeing all of our criminal legal system work, which includes our participation in the MacArthur Safety and Justice Challenge. I know with so many of you on the call today, some of you have great familiarity over the years regarding the charge of the MacArthur Foundation Safety and Justice Challenge. For those of you, you are just beginning to learn about it. And we'll be discussing it more today, especially as it relates to the Impact Network, which all of you are members of. So we're very happy to have you here. I'm going to start off today by asking my colleagues, some of you know them very well, but they are faces that you will be seeing a lot more over the years to come. And with that, why don't I start with Reggie? She seems to be primed and ready to go. Reggie, you want to introduce yourself?
Here we go. We got the face going on. Thanks, Travis. Hi, everybody. I'm Regina Herder. I'm coming to you from Denver, Colorado. Again, part of the team. Very excited about continue to work with our Impact Network first cohort, and now adding some wonderful new sites and new energy to the second cohort. So prior to coming to PRA 5 years ago, I was with the City and County of Denver as the Criminal Justice Coordinator. Good to see you all. And I think from there, I'm going to Lisa.
Thanks, Reggie. Thanks, Travis. Good to see everybody this morning or this afternoon for some. Again, my name is Lisa May, and I am a Senior Project Associate with this team. I am located on the outskirts of Atlanta, and so happy to see everybody's smiling faces. We are so excited to continue this peer learning project to exemplify the best practices that are going on in each and every one of your jurisdictions and continue to allow quality improvement in their program and services. My apologies for not being on camera today, and I will give this back over to Ashley or Travis. Thanks everyone for being here.
Thanks, Lisa. My name is Ashley Kreider. I'm a Senior Project Associate and the Assistant Director of the Impact Network at Policy Research. And I am the only one of our team that's actually near our office. We're based outside Albany, New York, upstate New York. And although at this point, what does that matter? So we've been working with SJC for several years, and you'll hear more of the history of what we have been involved with the Impact Network and beyond in just a few moments. But again, thrilled to see familiar faces and some new ones. And I'd like to turn it over to my colleague, Sam Zatola.
Hi, everyone. I am a Senior Research Associate with Policy Research Associates. I work in the program, evaluation, and research area of the company, and I'm really excited to be here today.
Thanks, Sam. You'll hear more from her towards the end of the call. But right now, I'd like to introduce one of the reasons that we're all here, and that's Lori Garducki, the Director of Criminal Justice at the MacArthur Foundation. Many of you know her well, and again, this is a new face. So Lori, would you mind introducing yourself?
Thank you, Ashley. Good morning and good afternoon to all. Someone just muted me. Okay, now I'm unmuted. Good morning. I'll try that again. Lori Garducki with the John D. and Catherine T. MacArthur Foundation. As many of you noted, good morning and good afternoon is in order. Delighted to be with you this morning and for the launch of the second cohort to join the Impact Network. I did want to say something about the origins of the Safety and Justice Challenge, because that's both integral to the work of all of you and your commitment to changing the way America thinks about and uses jails, and particularly its overuse and misuse as it comes to those individuals who suffer from behavioral health disorders. So for those of you who've been along, you know our origin story, but I think it is important to say a few words about how the work of the Impact Network is both carrying forward the work of MacArthur, but also has its origins and some issues around racial justice and equity that the foundation has had a longstanding interest in. As many of you know, the Safety and Justice Challenge actually has 3 elements. It has the network, of which this expansion to additional sites is important, but we also have a set of knowledge development activities, and we also rely heavily on amplification or the communication of our work, both to sustain those best practices, but also to carry momentum forward, not only in our particular jurisdictions in which we have worked, but nationally. When we first entered the field, most of the attention was actually at the back end of the criminal justice system. It was concerned about sentencing reform, conditions of confinement, and re-entry. And less attention was being paid to what happens at the front end of the system. And that's why the work of the Impact Network has been so critical. So what we try to do with SJC is change the public perception of how jails are used, who is incarcerated, and to what end that promotes community safety. Our goal, of course, is to see fewer people incarcerated, but also it's to see additional jurisdictions participating and engaged in reform. But at the bottom of the bottom line in this story, of course, is that we want to see a more fair, just, and equitable use of jails. Now, our partners and allies in this range from communications partners like the Atlantic Project, the Pointer Institute, Podcast 70 Million, R Street, to our strategic allies, those organizations that represent the system stakeholders in the field, such as the Association of Prosecuting Attorneys, the International Association of Chiefs of Police, judges, and so on, as well as at the state level, the National Conference of State Legislators, at the county and city level, but most importantly, those individuals whose lives and whose communities have been impacted by the justice system. Now, what had initially brought all of you here, of course, is as a result of the work you've been doing, looking at people with behavioral health disorders who cycle in and out of jail, and also in many jurisdictions are a driver of racial inequities. But I want to point out that when we look at the Safety and Justice Challenge, it's really a holistic systems change or transformation approach. So we look at all of the decision points, similar to what the sequential intercept map points you to, but it extends far beyond that. So recently we made an effort to collect all of the strategies that have been implemented by the nearly 60 jurisdictions participating in the network across over 40 states. And what we have identified is 325 different strategies to address over-incarceration in the United States in 30 different areas. So you're joining a very robust community of policymakers, practitioners, people with lived experience who are all seeking to have a fair, more just and equitable criminal justice system. And what I want to underscore to you is, while we've been very proud of the success of our jurisdictions in reducing their jail population, we've also been holding ourselves accountable. So if you want to learn more about the Safety and Justice Challenge, I encourage you to go to the website where you see the work of many of you who are on this call and those of you who are just joining the Impact Network for the first time. And you'll see how we've posted the information about the progress of the Safety and Justice Challenge over time. And what we can say is, as the jurisdictions have safely reduced their incarceration rate at a rate greater than what's occurred nationally, there's something like 17,000 fewer people in jail today than there were when the initiative was launched back in 2015, 2016. And that we can say that was achieved safely. So there does not appear to be any correlation between a decrease in the incarceration rate and an increase in violent crime rate. And I know that that narrative is very disturbing to all of us, that has taken hold, that suggests that reform somehow leads to an increase in crime and violence. And I urge you to take a look at some of the reports that have been issued, where we can say with great confidence that the minority of the few individuals who rebooked into jail, it was very rare for those individuals to be rebooked for a violent crime charge, and exceedingly rare for those individuals to be booked on homicide, less than 1%. And most individuals released on pretrial were not rebooked into jail, which has been consistent over all of the years of the initiative. And I want to underscore that because of the importance of the work at the front end of the system and where, in particular, behavioral health intersects. So I'm delighted to have new members of the network join of the Impact Network, join the community of practice of the Safety and Justice Challenge Network, and also just underscore the Foundation SJC's commitment to advancing racial equity and justice, to confronting our history in this country of systemic racism, having authentic community engagement, and collaborating with the people who are most impacted by the system, ensuring equitable outcomes, and upholding the safety and human dignity of all. So delighted to be with you. Look forward to seeing some of you in St. Louis next month and having an ongoing conversation and discussion and relationship with the rest of you. So Ashley, I turn it back to you, and thanks.
Thanks very much, Lori, for setting the stage and laying that foundation. I think equally helpful to our new sites as to the sites that have been involved for a couple of years or longer than that to, again, hear about these common pillars. So appreciate that. And in the interest of giving most of the time today to the sites and to hearing from most of you, I'd like to just do a quick overview of the agenda. We are going to touch on some of the things that Lori mentioned already. So a little bit of our history of the Impact Network to date, some of the resources that she mentioned and others that we have available, in particular to our 6 new sites. And then again, we want to spend the bulk of our call today hearing from the sites. So both to for us to get an idea as TA providers, even better where you are and where your strengths and history lie and where you'd like to learn more across the intersection of behavioral health and the criminal legal system, as well as to allow the sites to get to know each other. And we know obviously this network is based on a peer-to-peer learning model. And so much of what we've done over the past 21 months is really that site-to-site sharing. So we've dedicated most of the time today to that. Following the site conversation, we'll talk about next steps and upcoming activities and have some time for questions. And we'd encourage you to feel free to chat your questions throughout, and we'll be checking that and make sure to bring them up. So again, equally to orient new sites, but also kind of remind our current sites as far as what we've covered over the last 21 months. We've done a lot, and you can see on the slide here just the high-level calls that we've had, webinars, topical TA across sites, but we know there has also been a lot of individual site contact, TA individual calls, and sometimes matching up sites with each other to talk about challenges and lessons learned. But this is just an overview of again, those official calls that we've had, many of which have been recorded, are available as resources for our new sites. So we'll be, again, sharing all of this information and all of the other resources that we talk about today following the call. So again, it's hard to believe we've been active this long, but July 2021, we held our kickoff with the original 11 Cohort 1 sites. And we followed that by 2 sort of foundational technical assistance topical meetings, both around behavioral health data tracking, evaluation, and again, critically equity within this intersection of our population. We also had a virtual technical assistance series that was organized across the sequential intercept model, and most or all of these calls featured you as sites and additional SJC sites and others really sharing your expertise around these different intersection points. We've also had sequential intercept mappings, both virtual and in person with many of the sites. And that's, again, as the new sites know, an opportunity for you to increase cross-systems collaboration and start to identify those action plans and those priorities as far as the work you want to focus on. And then we've also been able to convene the sites in person. So last September, we had 11 sites in Atlanta in person. And as Lori mentioned, we'll be doing that again in just a couple of weeks in St. Louis. So it's very excited to be able to have an in-person space again. And then finally, over the last few months, we've been working on recruitment for our new 6 sites, and we're very excited about that. We did have an onboarding call with the 6 new sites a couple of weeks ago. And again, really, really thrilled to bring this new energy into the SJC. One more resource that I wanted to mention is to be released very soon, and that is a set of profiles on the original 11 Impact Network sites that have been involved since 2021. Once we start to work a little bit with the 6 new sites, we'll also add the information in there for them. So we'll have all 17 sites, and this will be available to all of you as a resource, again, to increase those site-to-site collaborations and learnings, and really start to look at the impact of this expansion network and the SJC more broadly. So this is coming very soon. In the next couple of weeks, we'll have it emailed out to everyone. And in addition to the individual site profiles, we have some comparison graphics as far as this different strategies across the sequential intercept model and where these sites are focused around behavioral health needs in particular. So coming very soon. I'm going to turn this back over to Travis now and talk about some additional SJC resources.
Thanks so much to you, Ashley, for this overview, and to Lori. Really appreciate having you here today so the sites can see you and hear more about the overall initiative. What I'd like to talk about briefly next is, as you can see on this slide, some of the resources that are available to you as members of the SJC Impact Network. We will hold regular but periodic topical technical assistance calls within this Impact Network. Just to give you some examples, since July of 2021, we have had topical calls related to information and data sharing across the 6 intercepts of the sequential intercept model. We've had discussions of how COVID has impacted not just jail populations, but also specific to persons with behavioral health disorders who become ensnared in the criminal legal system. We've talked about specific diversion and deflection strategies that are going on across the Impact Network sites, and learning more about what has been successful and what has been challenging across those strategies. We've also focused on specific intercepts along the way. One of the topical TA calls really focused on what was going on related to diversion and deflection in intercepts 0 and 1. And as a result of those topical TA sessions and discussions, there is a crisis center group that has spawned out of that and is now made up of many jurisdictions, even those outside of the Impact Network, as members of the Impact Network has said, I have a neighboring community that I think could really benefit from these discussions, and more jurisdictions have been invited. So like the second bullet point says, this is really an opportunity to connect with other sites and technical assistance partners that are all a part of the Safety and Justice Challenge and this initiative that has been going on since 2015. And we really view this, as you've heard both Lori say and Ashley and others, this is really a teaching and learning community. We want to build off of your successes so that other jurisdictions can learn how to bring strategies to scale to help keep people with behavioral health disorders out of jail in the first place. But we also want to hear where your challenges are at, because there are going to be other sites, other jurisdictions that are part of this Impact Network that may have had successes where you are finding challenges. And that's very much what this teaching and learning community is all about. We also want to have a nationwide impact. So product development becomes very important to the work that we're going to do the next few years. There are 17 sites right now as part of the Impact Network, but we want to have a broad reaching impact to other jurisdictions around the country that want to learn from your successes, that want to learn from your challenges, and to learn how to bring strategies to scale in their own communities and learn more about resources to do so. We want you to become integrated into the larger Safety and Justice Challenge network if you haven't already had the opportunity to do so. And that's part of what's going to happen next month in St. Louis. We're not only going to have our smaller Impact Network specific meeting on May 3rd, but some of you are going to have the opportunity to attend the next 2 days to the larger SJC network meeting that has over 60 jurisdictions and states making up that network right now. And that next bullet point about traveling to representatives from your sites really ties into that. And I know many of you have already started to make your travel arrangements, have obviously already registered for both the Impact Network meeting as well as the overall SJC network meeting. And so we'll have a chance to talk more about that. And finally, last but not least, there is an extensive resource library that is available to you as SJC network members. I know just the other day I saw an email saying that there were 999 resources currently available in the SJC library. I don't, if there was another email that came out saying we had pushed over that 1,000 resource mark, I may have missed it, but I know we're teetering right there around 1,000 resources that are available. So if there is a topic that you are looking for help with, that you're looking for information on, that you're looking to make connections with people and communities on, whether it's behavioral health related or not, I promise you, if you go to this resource-rich library, you're probably going to find what you're looking for there. Next slide, please. Two of the newer reports and resources that have come out and are available to Safety and Justice Challenge members are the two that you see on the left, one on the left side of the screen. Both of these, though, are specifically focused on COVID issues related to jail populations, crime, arrests, and things like that. The one on the left comes from the City University of New York, the Institute for State and Local Governance, or ISLG. And the one on the right was put out recently by the JFA Institute. So again, just examples of some of the newer resources that have come out. But again, we would encourage you to go to the link on the last page. And if you haven't already signed up to become a member of the SJC network and to get access to this library of resources, we can make sure to send that out to you. All right, we have now come to the portion of the agenda where we want to hear from all of you. And we're going to do this in a very systematic way between Cohort 1 sites that have been with us for the last 2 years, and then finally moving into the 6 new Cohort 2 sites. Again, this is an opportunity to spend a very brief amount of time. We're going to give each site 3 minutes, and I'm going to do it the old-fashioned way and pull up the stopwatch on my cell phone. So we're going to go in the order that you see on the screen. There will be slides that will be displayed that talk about some of the team members for each jurisdiction, areas of behavioral health focus to date, some of the strengths and what you want to gain and learn. So it's a lot of information to cover in 3 minutes, but really pay attention to what you're hearing from each site, because this is where you're going to start to form connections in terms of strengths and areas where you want to grow in. So we're going to start with Allegheny County. And who is going to take this for Allegheny County? Don't be shy now.
Hi, I'm here. I think it's me, Jen Batterton from Department of Human Services. I have been scrolling to see if I have any other colleagues on the call, but it's a court holiday, though not a county holiday. So I think it's just me.
So Jen, what I'm going to do for you here, and you get to be the guinea pig the first go around here. At the conclusion of 3 minutes, I'm just going to put a message in the chat box that will pop up and just tell you that your time's up. Okay.
Sure. Sounds good. I will not use up my time reading the names of team members and our roles, but we've got a lot of great partners from across our systems that are typically participating in various ways in this work. Around our behavioral health focus to date, we have been really focused on a lot of our, intercept 0 and 1 kind of work over the last couple of years. We have now launched law enforcement assisted diversion in 8 of the 130 municipalities that make up Allegheny County, and have expansion plans to scale that in the coming years. We have also now identified 4 police departments in addition to the 8 that are piloting law enforcement assisted diversion, another 4 with whom we have been collaborating very closely on a model to pilot alternative response to 911. And again, this is complicated in Allegheny County because we have 130 municipalities and 110 municipal police departments. So we are sort of taking a police department by police department approach necessarily with some of these strategies. We are also doing a lot of great work on building out access to medication-assisted treatment and other services to prevent to support individuals with opioid use disorder. We've made a lot of strides in the last year around the work that we're doing at the jail for people who are entering the jail on medication-assisted treatment and being able to continue them, and looking toward expanding that to be able to initiate people, which is not yet possible at scale in Allegheny County at the jail door. We've also focused on a really nice effort that brings together on a pretty regular basis a group of stakeholders from our criminal justice system, probation, the courts, the public defender's office, and our behavioral health provider network to come up with a set of protocols around communication that maximizes the possibility of keeping people under probation supervision in the community, even when they may be struggling to sort of meet requirements in a given community-based placement that might tend to result in a probation violation. We're sort of trying to troubleshoot that intersection point between our providers and our criminal justice system partners. And I think I said mostly what I wanted to say. I don't know. Did I say what you wanted me to say?
That was perfect, Jen. Thank
Okay.
you. That was wonderful. Moving right along, we're going to go to Charleston County, South Carolina next.
Hi, I'm Ellen Steinberg. I'm the director now of Charleston County. You all may be familiar with Christy Danford. I'm not sure if Suzanne is on this Zoom meeting with us. Nope, I guess not. Okay. Do we want to put up the Charleston? Do you have any? There we go. Oh, look at that. Okay. So let me do my best to fill in and plug in. Let's see. I will tell you where we are right now. What we've really recognized is that among the people that we're focusing on, we're only dealing with 3 to 4 people a year because everyone requires so much attention and so much assistance. We're finding that housing and transportation is a #1 issue that we're trying to work through for these individuals. And of course, substance use disorders and mental health. The other thing that we have run into is it notifies our strength is collaborative problem solving. We have a wonderful team group who, I mean, we could call them together, and it does happen sometimes 2 or 3 times in a week. What we want to learn is really how to intercept, how we can take care of this sooner, earlier than later. And oftentimes the individuals are not, they're not open to what we extend, that they do not want to be involved with us. So that's kind of been a challenge that we're working through. And let me think, what else can I tell you? Like most of you, we're all coming out of the COVID world, and that's kind of changed a lot of what we're doing. The good thing, again, I'm gonna really end on a good note, because in Charleston, we do have really a strong group of team members. This does not reflect everybody, and it's been growing. So again, this is about all I can offer you right now. If you have any questions, I'm happy to answer them.
Perfect, Ellen, thank you so much for doing that and providing the overview. We're going to next move into East Baton Rouge, Louisiana. Anybody from EBR that's with us today?
I'm not sure if they were able to join. Do due to the court holiday, but I was there a couple of weeks ago doing a sequential intercept mapping, so I can touch on some of this. Again, this is a site that has been involved since the start of the Safety and Justice Challenge back in 2015-16. They, in addition to Charleston, have a really strong SJC, so a good site to chat with around that. And they've also implemented a crisis stabilization center since the start of the SJC, actually just 2 years ago. And they have a really quick turnaround as far as law enforcement referral there, and some strengths again to intercept 0 and 1, like you've been hearing from Allegheny and Charleston. They've also focused at intercept 2 and pretrial, which is not always an intercept where we see a lot of activity. So again, a good site to approach for that work. And they've worked in the, kind of cross systems collaboration space, as we've mentioned already, through their SJC and other areas. So we can put you in contact with them, and we'll also have everyone's contact information, just so, to be clear, after the call. I know that was less than 3 minutes.
You did a great job, Ashley. Kept it about 1.5 minutes. Thank you. All right, we will now move into Milwaukee, Wisconsin.
Good morning and good afternoon. I'm Erin Perkins. I'm here from Milwaukee County to give you an overview of our mental health work. I apologize if you hear any noise in the background because the gutter cleaning guys just showed up when I had to do this presentation. So Milwaukee County has been part of the Safety and Justice Challenge since 2015. So we were one of the original SJC sites. And we've always had a behavioral health strategy in some way, shape, or form. Our strategies, as we've absorbed different positions and sort of looked at our lessons learned and sort of retooled our portfolio of SJC work, we've kind of changed our strategies over time, but we've always had a behavioral health strategy since we started, just because it's been such a priority, both for our system stakeholders as well as for folks out in the community as well. So you'll see our partners that are on the right-hand side of the screen. I apologize to Ashley because you asked us to give you an update, and I think housing is still on here. The housing division was one of our partners during phase 2 of the Safety and Justice Challenge, but the rest of the partners that you see on the right-hand side of the screen are all still part of the picture. So you have the County Behavioral Health Division, which provides a criminal justice liaison who meets with people who are in the jail and helps to connect them to services in the community, and also advises attorneys from our district attorney's office and our public defender's office on available resources and helping to get people connected as people with behavioral health needs show up in their caseloads. We originally, during what we called post-booking stabilization, or the PBS program, had a housing division navigator that was paired up with clients as they came through the jail and kind of fulfilled the same sort of function that the CJ, or the criminal justice liaison, performs now. But they were more of like a hands-on case management, whereas the behavioral health division liaison is more of like a quick handoff. It's a warm handoff, but also a faster handoff than we were able to do with the housing specialists. So just around the phase 3 part of the Safety and Justice Challenge, we retooled the team to allow for that liaison in place of the CIS workers. We also, of course, have partnerships with Milwaukee County Courts. We have judges that are part of our team, especially a judge that oversees the mental health court. And then we also have an attorney that works with us from the public defender's office that rounds out our behavioral health team. During phase 2 of the Safety and Justice Challenge, we funded a countywide CART team. CART are the crisis assessment response teams that we have in Milwaukee County. We had teams that were for specific areas of Milwaukee County, but we didn't have a countywide team at the time that we started with the Safety and Justice Challenge. So we used funding from the grant to be able to start that team and sort of expand the capacity of that program. We also introduced the brief jail mental health screen as a tool as part of our screening process in the jail to help identify people with behavioral health needs. Post-booking stabilization, as I mentioned. Oh, I'm sorry, that 3 minutes went fast. Just quickly, so we retooled PBS, which is our mental health diversion program. Currently we're working on expanding the capacity of our mental health treatment court. So we just brought on a mental health court coordinator using some additional funds to help expand our capacity in that way. So that's kind of Milwaukee County in a nutshell. I'm happy to be available for questions. I can also post a link to our website as well, so people can learn a little bit more about Milwaukee County Safety and Justice Challenge activities.
Thank you very much, Aaron. Great overview. And as my colleague Reggie Herder had pointed out a few minutes ago, if you do have any questions for sites as you're listening to them, please feel free to type those questions into the chat box, or we can also wait until the brief Q&A session at the end of this meeting. The last, but certainly not least group out of this mix of 5 sites is Pennington County, South Dakota. The one thing that I want to point out to all of you as the representative from Pennington County is kind of getting queued up here is these first 5 sites that you're hearing from have been original Safety and Justice Challenge member jurisdictions since back in 2015. They are what are called implementation sites, and so have really been working on a number of strategies with funding from the MacArthur Foundation since the very get-go. And so these were 5 sites that were part of Cohort 1 for the Impact Network as well, focusing specifically on behavioral health issues. So Pennington County. Just checking to see if we have anyone from Pennington.
I don't know if I see them. Well, Reggie, Travis, and myself, we've all been kind of involved there. Does anyone want to give a quick summary of their work?
Reggie, you may have been most recently there. I don't mean to put you on the spot, but you want to.
No, happy to do that. So Pennington, especially for those of you that might be in a little bit smaller kind of jurisdiction, Pennington is a really interesting place in the work that they're doing. So they have created a care campus, and the care campus is everything from a sobering unit through a mental health crisis unit all in one area. They also have been doing a lot of work around methamphetamine use and have created both a residential and then community-based treatment around methamphetamine in particular. Because of the location in Pennington, work with Tribal Nation is front and center in all of their efforts. And so they've done a great job in trying to pull in and work with the greater communities, both tribal health, and also really trying to honor persons from that perspective. So if you're working with any of those areas, would strongly encourage you to reach out to them. They've also been really focusing around diversion work and in the very front end of their system to try to get people into a more of a community setting and at bond, and then trying to reduce the impact that they might have later on in the system. So would love to, if anyone has questions about Pennington, love to connect you with either Barry or Liz. And I think you'd find their work to be extremely interesting. Housing has been another big focus for them over the last couple of years. And similar to what Massachusetts has been doing, they've been really focusing on how do we really kind of braid and blend funding streams. So great site to follow, one that we often highlight, again, especially around that care campus.
Wonderful, Reggie. Thank you. They should put you on the payroll in Pennington. So you just heard from the 5 implementation sites that have been a part of Cohort 1 of the Impact Network. Now we're going to move into 6 additional sites that became a part of the network 2 years ago in 2021, and also joined as Cohort 1 members as part of the Impact Network. So we're going to start with Eau Claire, Wisconsin.
No one's on from Eau Claire. I don't know that I did see anyone here. So I can also report on that. Was just there last September, I think it was, and did a sequential intercept mapping for them. Eau Claire, of course, kind of very northern part of Wisconsin, has really been working around the sequential intercept model and looking in particular at diversion opportunities and also jail and jail reentry. So they've really been building that particular part of their work out to identify folks who are in jail and try to look at how do we both get them back into the community, but also are people who are coming into jail, what's the opportunity to try to prevent them from coming in the first place? So they are doing screening, the brief jail mental health screen at booking. They have created a co-responder model and are really trying to look at how to grow that particular work to be more fluid and 24/7. And then data collection is a really strong part of the Eau Claire model. Again, a smaller community, but has been doing some great kind of cross-system work. And a big part of their work has also been around substance use disorder, again, methamphetamine and opioid use disorder. So that is kind of where they are right now. And just really, again, a great community to connect with, again, a little bit more of a rural setting for some of you, or in a little bit smaller areas. Happy to connect you with them.
Wonderful. Thanks again, Reggie. Really appreciate it. Next, we will move into Middlesex County, Massachusetts, and I know there are some representatives on the call today from there.
Hi, this is Catherine London, and I am a principal at For Health Consulting, now called at UMass Chan Medical School. We've been supporting the Middlesex County project for a while. I wanted to introduce a new staff person, Chelsea Thompson. Chelsea, you can say hi so your screen comes up.
Hi, everyone. I'm Chelsea Thompson. I'm a Health and Justice Policy Associate. Today is day number 5, and it's so great to see so many of you. I was involved in SJC work in my previous role at the National Association of Counties. So excited to be with this group and on the local policy implementation side.
So we're thrilled to have Chelsea, and Chelsea's going to attend the meeting next month for Middlesex County. And she's going to be the primary representative, so you'll see going forward. So we're just thrilled to have her here. For people who've been following, we haven't made a lot of progress in the last month or so, but I guess for the new folks, where we are is we're building a restoration center, and we had spent a few years doing research and talking to lots of stakeholders and developing a model. We put out an RFP last year and we didn't get any respondents, so we were so disappointed. And so we've been spending this last year talking more with vendors and figuring out what will work in the community. Our state had also implemented a huge behavioral health expansion at the same time last year, and they were largely just really busy focusing on the Medicaid expansion. And so now we're talking about they have a little more space to sort of brain space or organizational capacity to focus on this now and take the behavioral health centers that they built for Medicaid and expand to include all of the aspects of the restoration center that we're adding in the specific focus on jail diversion and prevention. And so, the model is basically that people can show up with any mental health or substance use need anytime, day or night. There's an assessment and they figure out where the person needs to go and they get them there. It includes transportation and escorting and some units that'll be in the building and some might be nearby. And we're experimenting, with a range of types of services that are licensed in the state, and then adding sort of a generic, what we're calling a harm reduction unit. And we're looking for the providers to be a little bit creative about what would that look like that they can do. So that's where we're in progress now of drafting up.
Wonderful. Thank you so much, Catherine. And Chelsea, it's a pleasure to meet you, and we'll look forward to seeing you next month in St. Louis. All right, we are now going to move to Orange County, California.
Good morning, everyone. My name is Tamika Williams, and I'm an assistant district attorney here in Orange County. I also have on the call our Assistant Head of Court, Ann Seelan. Ann, can you say hi so everyone can see your face?
Hi, everybody. Can you see me?
And I also brought one of our justice partners, Jen Nicolade, who is my counterpart in the Public Defender's Office, and he'll be joining us in St. Louis. Jen, are you able to say hi?
Briefly, I'm in court. Hi.
Oh, she's in court. Thanks, Jen. Okay. So here in Orange County, we started a diversion or deflection program called First Point. And our goal at the time was to try to decrease with low-level crimes individuals in the community who are contacted by law enforcement and who want services. If they connect with services and make a substantial effort toward that, we will not file their case. So it was really a idea or goal at Intercept One to try to decrease and connect services for some of our familiar faces or anyone in the community. And what's exciting about this, and in terms of our, I'm just looking at our slide. So it says District Attorney Jess Rodriguez. It was his brainchild along with Ann, and I've taken over in January, and I'm excited to be a part of the Impact Network, but the greater California network as well. But we have partners, including Healthcare Agency, who comes up with a treatment plan, our social services agency, who comes up with services and benefits for these individuals. And we've started with 3 partner law enforcement agencies. Orange County is a huge county, home to Disneyland and all of that, right behind Los Angeles and San Diego, large counties. But greater picture here is our board of supervisors for this very large county has had a 5-year strategic plan to help serve, connect, reduce the jail population, and increase reentry services, called our Orange County Criminal Justice Coordinating Committee. Basically, every department head, every touch point for these familiar faces in our county across the intercepts, it's part of this larger picture, of which our diversion program is just a small component. But we are making huge strides there because of this coordinating committee. Everyone is coming to the table, so we have buy-in across all county agencies to assist us. We are struggling with with our diversion program, once we contact the individual who wants services, finding them later. So we are working and have been supported by the Impact Network to strategize and figure out ways to fill those gaps. But we continue to be passionate about the work we're doing, as is everybody, and we're excited to be a part of this network. Thank you.
Tamika, thank you so much for that great overview and some of your colleagues. We appreciate that. We're now going to move to San Juan County, New Mexico.
I think we might be missing San Juan also, unless somebody jumps in. Lisa, I just saw you on mute. Do you want to chat about it a little bit?
Absolutely. I can certainly speak for San Juan. So San Juan initially applied for the Impact Network for Cohort 1, and they really wanted to look at the judicial system and work through intercepts 2 through 4. So their core team consisted of the managing attorney of the Public Defender's Office, the District Attorney's Office, in addition to the problem-solving courts. We have the Division Director of Problem-Solving Courts, a part of the core team, and the Director of Behavioral Health department there. And when they initially signed up, they certainly knew that they wanted to lower the amount of people who were being booked into jail, but really wanted to take a focus on those who were being booked into jail, how to reduce their length of stay. San Juan ended up having a sequential intercept model mapping workshop February of 2022, a little over a year ago. And they came out with specific strategies and priorities through that workshop that they were committed to working on, which included a jail diversion and reentry priority to increase the communication and coordination around pretrial services and increase the access to reentry services to everybody who was being released from jail. They also wanted to work on specialized training for their jail staff, for individuals with probation and parole, in addition to community-based providers. So they had really had a nice objective of putting together a training inventory and identify areas for expansion and share information as it relates to cross-training. So as we know, this industry just struggles a lot with workforce development, and there have been some changes within individuals from the core team as it relates to succession planning and people resigning. So we are just encouraging San Juan to continue to be involved and engaged and reach out with any questions and any technical assistance that they feel that we can continue to provide. But as we all know, when somebody leaves and that position isn't replaced with somebody, roles and responsibilities get pushed over to other people. So we certainly understand the comprehensive workload that they have and know that we are here for them. And if anybody would like to reach out or be a part of that, just let us know. Thanks, Ashley.
Thank you so much, Lisa, for stepping in and providing that update for San Juan. We're now going to move into the Texas Health and Human Services Commission.
Good afternoon. I've got to be like most people. You can hear me, correct? I can't. I'm trying to figure out how to turn my video on. Anyway, I'll go ahead and talk. Robert Dole here, Deputy Associate Commissioner of Rural Mental Health. Glad to be here. It's a cold and rainy day in Austin, Texas, and our team is comprised of myself, our forensic director, Dr. Jenny Simpson. We had a change in our peer person with lived experience. We have now the director of peer services and recovery, Noah Abdenauer, as a participant, but our core team remains the same. We can go to the next slide. So these are our partners. These are basically the top half and the western portion of our state. These are all local mental health authorities. Most people know them in other states as community mental health centers. They serve large service areas, and all of them are implementing some type of pre-arrest diversion activity, either that's co-responders, crisis receiving centers, the remote evaluation through co-responders, and or drop-off centers. And they've been really incredibly successful in terms of diverting people with a mental health condition away from jail who are not a threat to public safety. Next slide. So what, to give everyone a thumbnail sketch, part of how we're working with these centers is through a statewide initiative where we work with rural serving local mental health authorities called All Texas Access. And for the 2022 report, which I'll put in the chat when I'm done talking, we challenged each of our 30 LMHAs that we work with, of the 39 that are present in Texas, to develop one strategy to divert people with a mental health condition away from the criminal justice system. And I'm really glad to say, of the 30 local mental health authorities that we work with, 23 of which have gotten funded through either direct federal funds, other grant opportunities, or block grant funds. And 8 of the 30 that we're working with were funded through HR 133 and ARPA funds. And I'm really excited to say that in the first 6 months of implementation, they were able to divert 3,000 Texans with an estimated cost offset of around $9 million for incarceration and other related costs. So other developments are our forensic director in the Office of Forensic Coordination has been able to publish the Forensic Strategic Plan, which is part of our statewide behavioral health strategic plan. And I can put that in the chat as well. And our forensic director and her team has been conducting sequential intercept mappings across the state, especially focused on rural communities. They had the SIM Summit, and we also, earlier in our evolution, we did a community of practice. And also what's really exciting is the Office of Forensic Coordination has been able to kick off the statewide Behavioral Health and Justice Technical Assistant Resource Center. So our area, rural mental health, has been able to really work with, oh, sorry, Travis, I'll wrap it up. So anyway, so we have a team that's really focused on rural mental health and collaborations among the folks who operate in the rural space and serving as a point of contact, and also implementing All Texas Access. And also we're interested in focusing scaling urban best practices to solution in rural communities. So thank you all very much, and keep your eye on the chat for those various resources.
Wonderful. Thank you, Robert, for that great overview. Really appreciate it. And now rounding out the 11th of the 11 cohort 1 sites, we have the West Texas centers with Howard, Nolan, Terry counties.
Hi, this is Patricia Watlington. Can y'all hear me okay? Okay, good, because I'm in my car on my phone. So our team changed quite a bit from our very original team. We started out as an LMHA and only had behavioral health staff. Well, we quickly realized that we needed to have, probation and the courts and the sheriffs on our team. So we went out and started collaborating with them, and our team has grown from about 5 to the ones that you see on our screen now. So we're doing really good with that collaborative. That's one of our strengths, that we communicate well. We have our committee meetings often, and just really trying to figure out what that intercept is between justice system and the behavioral health system. We did get a grant, as like Robert mentioned, because we were part of his as well. We did get a grant both federally and statewide to build and implement a diversion center, a crisis receiving center. And that's going to be in our central location in Howard County. And that will be opened up by September 1st. We're hoping. We're in the planning stages of that. And we're going to be collecting data around that and trying to just show people what the work that we're doing and why it's important here. We continue with our jail diversion mental health deputy program, our jail caseworker programs. Those are really successful right now, trying to divert people as we can through law enforcement. And then if they get incarcerated, wrapping them up into our services to help them transition back into the community. Another thing that we did this year is we joined up with the Urban Institute with the Probation Network, and we added a couple of our probation partners into the Impact Network. And with that, so we're trying to find out ways to, other ways, instead of revoking people and going back to jail, what are some other ways that we can, identify their needs and fix that so they don't get arrested again. One of the things that we did in Nolan County is start a young person diversion, which is ages like 17 to 19, and trying to divert them from, the criminal justice system in the first place. So we're continuously looking for best practices in the court systems. I think that is where we really struggle in rural counties, because we don't have any kind of special courts here.
Patricia, thank you so much for that update, especially from your vehicle. We appreciate it.
Thanks.
Right. We are now going to move into the 6 new sites joining the Impact Network and forming cohort 2. And we're looking forward to getting to meet some of you for the very first time here in about a month in St. Louis. So we're going to start off with Donna Ana County in New Mexico.
Good morning. My name is Jamie. Monica and I work together, and I think she's on. but I don't mind providing a bit of an update. I'm with the county's Health and Human Services Department, and we have several of our team members, including Monica, on today. Some of our areas of focus to date, we've kind of had two phases of this work over the past, I would say, 10 years. We started off with the Stepping Up initiative, and as a result, we've built a really robust crisis response system that follows the National Crisis Now model. It's still brand new, but 2 years ago, we were able to open up a crisis triage center. We've partnered with the state, and we're doing the 988 call center universally across the state. And just recently, between the county and the state, we have funded a mobile crisis response team. So we have all three legs of the Crisis Now model working, still growing, some growing pains, but that has been an area of focus. We've tried to work on some pre-arrest diversion programs like LEAD, and those have been kind of slow to start. But we did a second sequential intercept mapping workshop a year ago. And as a result, we've put together another strong team for kind of like phase 2 of all of this work in our community. And we are still focused on the 0 and 1 intercepts, trying to do a lot of diversion. But we've also begun working with our county jail and the medical providers in the jail and looking at release. So we are trying to provide in-reach to the jail and case management post-release, and hoping that we can connect with some familiar faces and help with diversion at that point as well. So I guess our area of strength really is the Crisis Now model and what we've learned through that with our partners. And we want to gain from this data collection. I've heard a couple people talk about that, and that's really important to us. We are in the process of trying to figure out how we do cross-sector data collection so we can do a better job of identifying familiar faces and really look at what capacity our programs need to be able to serve so we can be more informed with that. And some of the other TA that I saw in the past is the 911 diversion, really looking at how to, now that we have a mobile crisis team that's based in the community, how do we divert those calls from the very beginning away from EMS and law enforcement and into behavioral health. So I'm happy to be part and be one of the new communities. Thank you.
Jamie, thank you so much for that great overview. You all got to hear my colleagues talk a little bit about where they were from. Reggie in the Denver area, Lisa May in the Atlanta area, and Ashley Kreider from right around where our office is at in Del Mar. I didn't get to share that I'm from Lincoln, Nebraska, and that's where I'm sitting at today. And the next two sites, Douglas County and Sarpy County, are just down the road from me in the Omaha, Nebraska area. So looking forward to hearing from Douglas County next.
Justine, I think you're on mute.
I remember to take my video off, but forgot to unmute myself. My name is Justine Wall. I'm the Rehabilitative Services Administrator from the Department of Corrections. And as I sit here and I've listened to a lot of the sites that have gone before me, it feels like we're working on a lot of the same initiatives that the other sites are working on, which just kind of reinforces to me that hopefully we are on the right path with dealing with the mental health concerns that we have. For this particular initiative, we have decided to focus on our pre-trial release program. Back in September, we implemented the public safety assessment and completely revised our pre-trial program. We worked with a lot of the stakeholders in the judicial system for Douglas County, and we weren't sure how it was going to go across. But when we implemented it, it took hold, and now the program has expanded quite quickly. So now I feel like we're kind of catching up to make sure that we're doing the proper supervision and implementing the right resources where they need to be. Also on our team is representatives from Sarpy County, which is a county right next to us. They are also working on pre-trial, so we wanted to kind of collaborate our resources together. And then that kind of going along with the pretrial population is we have a Familiar Faces program that focuses on high utilizers of the jail with SMI. We had that program a couple years ago, and with COVID, things kind of fell apart. And so we're wanting to reinstitute that because we had a lot of success with that. And so we started that, restarted that again about 2 months ago. And so we thought that since a lot of these individuals will be on pretrial release, we could combine our resources for the Familiar Faces program with our pretrial program. So that's what our focus is right now for this program. And I look forward to really hearing a lot about actually all the initiatives have been interesting and what I've heard about. So I am looking forward to hear about everything in this program.
Justin.
And I didn't know if I have a minute, if Sarpy County wanted to say anything.
Yep, Sarpy County's up next, so.
Well, there's someone on our team specifically from Sarpy County. Jake, I didn't know if you wanted to mention anything.
Yeah, I'll echo a lot of what Justine said. We're trying to finish up our implementation of the PSA over here in Sarpy County. And then one of the things that I'm hoping to kind of improve on here in Sarpy County is how we have mental health case management within our pretrial release program. We have a mental health diversion program, and then we have what's called our wellness court, like our mental health problem solving court, and making sure that we're identifying those people as early as possible in the process, when they're first incarcerated, to funnel those individuals to the appropriate program. So I think I saw David here on our mental health diversion office, and so that's just something that we're working on here in Sarpy. Thanks, Justine.
Thank you both, Justine and Jake. So let's continue the Sarpy County discussion. And I don't know, Joe, are you gonna be doing that for us?
I think I'm going to jump in and talk about it. So Tom Dargy, I'm the assistant administrator here in Sarpy County, and we've already heard a little bit about where we're located from other people, but kind of the easiest thing is we're smack dab in the middle of the country. So we've really been focused probably the last 10 years or so roughly on the intercept model and working to achieve that. We've had a few workshops on it, and we've really tried to be an innovator in the Stepping Note program. As Jake kind of talked about a little bit ago, we started our first mental health court in the state, and we had the mental health diversion for people who commit the low-level crimes. Our next step is we have a new jail that's going to be opening in the next few months, hopefully, knock on wood. And in that jail, we're going to have a mental health wing with the efforts to restore people that have mental health, they're suffering from mental health, to competency in there. And so with that, we have also started in our Sarpy County Sheriff's Office a mental health response team, and we're currently working to add an embedded therapist for them. And where all these things are kind of headed is the gap in our system is really kind of to divert to what, right? And focusing on a somewhere safe to take people, somewhere safe to go. And so the last few years, we've basically gathered all the law enforcement agencies in the county, the public defender's office, county attorney's office, the two big mental health partners in the metro area, which is Region 6 and Community Alliance. And we're really all focused now in a collaborative effort to try to build and staff a crisis stabilization center, which we currently don't have anywhere actually in the metro area. And so we're working on various grants and earmarks right now and trying to shake the money tree, so to speak, with some private donors to get the stabilization center, to make it a reality. And so our big goal really is to learn from the Impact Network, from everybody, as we listen to what's been said. It seems like there's a lot of people that have already been down that road. And so we don't want to reinvent the wheel. We just want to grab what we can from everybody to make this a reality. Thank you.
Tom, thank you so much for that. All right, we are now going to move to Issaquah, Washington.
Good morning, everyone. My name is Monica Negrela. I'm the Human Services Manager here at the City of Issaquah. We are a small municipal jurisdiction, small as in our population is about 40,000 residents. I'm also joined here by our court administrator, Christy Schoen. I'm gonna hand her the mic in just a moment. I just wanted to highlight, so we are about 20 miles away from Seattle. As I said, smaller municipal jurisdiction. We are part of the Familiar Faces Network. And so for this collaboration in particular, we hope for a collaboration between police, jail, court, and human services. So on the human services side of things, we have a behavioral health program where we work with the police department in providing support to behavioral health calls that come to 911. We also have a homeless outreach program, and for efficiency, we coordinate also with the Parks Ranger, and we merge the behavioral health and homeless outreach programs as we also now continue to work with the jail. What's unique about the jail here in Issaquah is that it supports about another 11 jurisdictions in the area. So we have folks who come from other cities as well. And that's also the case for the court, but I'm gonna stop here. So I'm gonna let Christy talk a little bit about the efforts at our municipal court.
Thanks, Monica. Yeah, we started our a community court program in August of 2021. We originally started the program. It was a pretrial diversion. We've slowly increased to mainstream court proceedings, where we offer resource room providers to folks with behavioral health needs. And now we're looking at opening our community court to the entire community. So what we're looking at where we need to improve is maybe some of the places we overlap with both of our human services team, fire, police, and jail services. Thanks.
Thank you both so much, Monica and Christy. It was a great overview. Let's move next to Natrona County, Wyoming.
Thank you, Travis. It's a pleasure to be here. My name is Ray Pacheco. I'm the Senior Director at the Natrona Collective Health Trust. We're a health conversion trust, and have been given the task of leading our sequential intercept within the community. We're about a year old within that model. Joining me is Christy Oster. She's our community case manager. So I'll let her introduce herself real quick.
Well, I'm really excited to be here and looking forward to the opportunities. From what everyone has said, I'll mimic a couple people. I feel like we're on the right track, but we are definitely going to learn a lot from everyone and what you guys have done. So I appreciate the opportunity.
Thank you, Christy. Just a couple things. This is just a small portion of our team members. We have a pretty large work group of about 30 individuals, stakeholders within the community that support and try to get job done within our community as far as our sequential intercept. So we have accomplished quite a bit. Travis, if you'd go to the next slide for me, please. Or whoever's doing the slide, thank you. A couple things that we've already done within Natrona County. We've already made significant progress within our re-entry program. Christy is our case manager within our community. The trust has committed to funding that position, and Christy helps individuals that are incarcerated in our local jail system to re-enter the community with the support and effort that she's been doing. We partner with a detention center, our community health agencies within our community to be able to get that done, our police department, our sheriff's department as well. So we've really kind of focused in on that, but we're also trying to focus in the next couple of probably several months, a crisis response team that we're hoping to get that established within our community as well. So that's a progress that we're trying to make as well. So we're hoping to get that probably as we're moving down that way to get that accomplished. One of the strengths that we really have is we have some really committed community partnerships. people that are really wanting to get some stuff done for our community as far as mental health and mental behavioral health, and those that are incarcerated and crisis response. And so those partnerships have proved incredibly strong. Since we've completed one of the areas in our priority areas, the work and the support from this impact network will help us to meet that need as we move forward. And Christy and I will be in St. Louis next month. We look forward to learning from the group and learning how to move forward and accomplish those goals within Natrona County. So thank you so much.
Thank you, Ray and Christy. And now rounding off the 6 cohort 2 sites, we've got Solano County, California.
Hello there. My name's Emery Cohen. I'm the behavioral health director, and sorry, my voice is a little hoarse today. And we had a lot of people on the call earlier, and I think that being last, some folks dropped off, but I do see that we're joined by our folks from the court and our NAMI affiliates also. So we're working really closely with our public defenders, probation, sheriff's office, a group of folks to help us with a lot of reform that's happening in California. As if Orange County's here, they know what I'm talking about. We have a lot going on in terms of diversion. We have so far in our courts, we have a drug court, a mental health court that's kind of still in the infancy stages. We have jail diversion also, that just most recently laws have changed on who qualifies and trying to figure all that out. And then we have a lot of areas from the state around care court and some other potential issues that are coming down, LPS reform. And so this is a perfect time to join this network and learn from all of you all and to see how we can streamline some of our processes for folks. Right now, about up to 45% of our jail population has a mental health issue. And so we're really trying to do a lot of diversion and trying to get services. We have now a 90-day in-reach law that passed. We're trying to figure out how to get in there sooner to get people eligible for Medicaid and get them into services and connected. So we have, several grants and things. There's a lot going on for us right now. We're like an initiative fatigue at this point and trying to make sense of it all, which is what we're looking forward to the SIM to be that kind of convening point to help us all be on the same page. And then get law enforcement also to help in terms of the early intercepts. We've recently launched our crisis intervention team training, or CIT training for law enforcement. We have CSU, we have mobile crisis that's getting ready to relaunch in our community. And so we have a lot of the early intervention pieces. We're trying to then figure out what's going on once people get in and how do we get them out quicker, right? In terms of, prevention and then intervention there. So looking to the network for some support on that. And I'm wondering if anyone else from our team, from either the court or our NAMI affiliates, wants to share anything. And if not, thank you. Thank you for having us.
Emery, thank you for that great overview. And I want to thank everybody that took the time today to share what's going on in your jurisdiction. We knew that that would be a challenge with 17 sites and only 1 hour to provide all these updates, but you did it, and really impressed with the richness of the work and the resources, but also the desire to learn from other communities. And I'm excited to see some of the chats that have gone on in the chat box and links being shared to websites or resources. And that's part of what this network is all about. And we'll look forward to continuing some of that work, not only virtually, but in person. And we're going to talk about next steps. And I'm going to turn it over to Ashley again.
Thanks, Travis. And I just want to echo thank you to all the sites for sharing that information. Not only did you do it, you did it almost exactly on time, which is maybe even more impressive. So appreciate that. And we'll, again, send out all this information as resources after the call. So we wanted to highlight just briefly a couple of things as far as next steps. And you'll hear a couple different people jump in here. Number one, and most immediately, is the St. Louis Impact Pre-Con and SJC network meeting that many of you will be attending. I know there's been different communication around travel depending on the cohort you're in. So appreciate you hanging with us around the logistics. But I think at this point, everyone has been, excuse me, registered, and our travel coordinator, Kelly, has reached out to travelers to coordinate flights and all of that. So if you have any, if you haven't seen those emails or you have any other questions around St. Louis, reach out to any of us and we'll get those answered for you. We will also be able to send around a virtual registration for the larger SJC network meeting. There are a lot of sessions that will be available virtually. So while only a couple of your team members can attend in person, that is totally open to the rest of your teams if you want to tune into any of it virtually, and we encourage you to do so. One of the other resources and opportunities that you've heard mentioned today is an every other month virtual meeting that we facilitate around sites that have either been planning for crisis stabilization centers or are implementing those. Some of them have implemented for several years. And that really came out of a grassroots request from one of the other SJC sites, Minnehaha, and a desire to connect to other sites, again, planning or implementing crisis centers. That is a group that has really naturally grown over the last year, and we have about 50 representatives from 25 sites currently meeting every other month. Again, open to any of the sites that they're planning or implementing a crisis center. As many of you have mentioned already, contact me if you want to be included in those call holds and the listserv. And we're also doing some surveying of crisis centers and some product development around that that I think will be a beneficial resource. So another opportunity. And then almost lastly, I'd like to hand it over to some of our colleagues on our research area at PRA to talk about another opportunity for sites. Sarah and Sam.
Thanks, Ashley. This is Sarah. Hi, everyone. I wanted to share an opportunity that could be of potential interest. Absolutely no required participation, but our team has funding from the Safety and Justice Challenge separate from this project and this work to look at the validity of pretrial risk assessment instruments, specifically in relation to people with behavioral health needs. So if there's any sites who are currently using a pretrial risk assessment instrument and also using a behavioral health screening instrument or FLAG, I know that's probably a lot of you, but if you have data on the individuals who are being screened with pretrial risk and also some way of identifying who has behavioral health needs. And then thirdly, if you have data on whether they had success or if they had any kinds of failures, both in terms of missed court appearances and also new crime during the pretrial period, we would be happy to have a conversation around the potential to partner on this validation process. So for us, the work is intended really simply to create opportunity to look at how pretrial risk assessment instruments are working in practice with a specific emphasis on people with behavioral health needs, because that's not done very often. And then for you all, if there are sites, and we already are working with a couple sites in the network, but if there are sites who are needing their instruments to be valid or wanting to look at the validity of their pretrial risk assessment instruments, this would create an opportunity for us to be able to do that for you without, partnering with other agencies or looking for more funding. So our funding would cover that piece of it. So it's a bit of a works for us and works for you all, hopefully. I see a note there about a one-pager. Happy to do that. We really only have capacity for maybe 1 or 2 more sites. We already have 3 sites that we're doing this with. But anyway, we'd be happy to have further conversations about if there's any interest and kind of what that would entail.
Wonderful, thanks, Sarah. And I see a couple of other requests in the chat for connections to crisis centers group and other resources. So we'll make sure to follow up on all of those. Thanks, folks. Lastly, before I hand it over to Reggie for Q&A, our next call following the St. Louis Network meeting will be June 1st. and that will be focused on coincidentally data collection and behavioral health, specifically at the jail around intercepts 2 and 3. So we have been talking about this topic really throughout our involvement with SJC, and it was one of the foundational TA meetings of the Cohort 1 group, but this continues to be an area of interest for sites, and we have some specific questions to ask, sorts of screening types of things around folks with behavioral health needs coming into the jail, and then strategies to share, and you'll hear from some other sites. So focused on data collection, screening, identification, again, at kind of intercepts 2 and 3, and we will send out the call hold for that one shortly. Finally, I will turn this over to Reggie to lead a little bit of Q&A.
So I'm always amazed. Thank you, Ashley and Sarah. I'm always amazed when I hear about all of the work that's taking place. It's a lot. So this is really an opportunity for any of you, if you have any questions, to ask those questions now. We have about 5 minutes. But also to note that as you heard from all the different participants, is that there is a lot of different work going on. And if there are things that really resonated with you, all you need to do is just send us an email that say, hey, can you connect me with, or wow, we really are interested in this particular area, and we can help kind of pull everybody together for different kinds of conversations. So again, it's not just about us helping to respond to you, but it's really about helping you respond with each other. So any questions at all that anybody had for any sites you want to bring forward? Anything at all? If anybody wants to do anything. And so we see, Christy, your note in there. Great. Any questions? You guys can just come on live if you want to. And if no questions right now, then maybe we can just wrap it up, Ashley and Travis. And again, thank you all. It is so impressive the work that's going on. Very excited to be able to work with you guys. And we will, again, the network, I'm already seeing folks are starting to sign up for things to kind of jump in. That's what makes us work, is you guys coming forward and saying, how do we do this? Lori, any final comments from you as we wrap this up?
Well, a shout out to PRI for starting the Impact Network. Its ambitious agenda in terms of what it wants to accomplish with all of you as peers and colleagues. We're looking forward to seeing you in St. Louis, those of you who will be joining us, and of course, continuing our relationship virtually. There's a lot going on in this space right now. Some of it is, well, a lot of it is very challenging and difficult. And I appreciate all of you, your passion, your commitment in doing this work. So have a great holiday weekend, and we'll see you soon.
Thank you, everyone. Have a great weekend.